Bismillahirrahmanirrahim. Have the courage to follow your heart and intuition. They somehow know what you truly want to become. Steve Jobs. Assalamu alaikum, everyone. My name is Rida Shahram Sarwar, and under my supervisor, Professor Dr. Saira Afzal, today I will be presenting family planning methods, the permanent ones. The main permanent methods in both males and females are shown. In males, it's vasectomy, which is 99.9% effective, and in females, this is tubal ligation, which is also 99.9% effective, as quoted by Healthline. Learning outline for today is Introduction to Family Planning, types of contraception, indications and contraindications of methods, mentions male sterilization techniques, then female sterilization techniques, advantages, disadvantages, and recent advances in the field. Learning outcome. At the end of the presentation, participants will have a broad overview of the different types of sterilization techniques employed for both males and females, their advantages, disadvantages, procedure, processes, practicality, and indications for couples when it comes to family planning. Family planning is the voluntary planning regarding childbirth. That is, the childbirth should be according to desire or choice, not by chance. By controlling birth through family planning, the size of family can be limited and population growth can be controlled. It helps individuals save lives, support families, and benefit societies. Family planning refers to practices that help individuals and couples to attain certain objectives, which include to avoid unwanted births, to bring about wanted birth, and to regulate interval between pregnancies. Contraception. The methods or devices used to prevent pregnancy are known as contraception. Basic meaning of contraception is simply prevention against pregnancy. This is a diagram of the different methods of contraception. Types of contraception include permanent and temporary kinds. Temporary contraception includes condom, diaphragm, chemical methods, hormonal methods, and intrauterine devices. Permanent method or sterilization include vasectomy in males and tubectomy in females. This is a diagram of both vasectomy and tubectomy. In vasectomy, you can see the tube being interrupted, and tubectomy, you can see the fallopian tubes tied and cut. Guidelines for sterilization. Husband's age should be in between 25 to 50 years. Wife's age in between 20 to 45 years. Must have 2 living children. If the couple has 3 or more living children, the age limit may be relaxed, and you also need consent from your spouse. Indications. In males, sexually active and physiologically adjusted husband with desired number of children, and in females, after having desired number of children, medical diseases like diabetes, hypertension, renal disease, for preventing ovarian and peritoneal cancer, fetal malformations like hemophilia, Tay-Sachs disease, and Marfan syndrome, and in case of multiparity and 3 cesarean deliveries. Contraindications include young women less than 25 years of age, parity less than 2 children, local infection, as well as prolapse. Male sterilization or vasectomy. There's 2 types of this. There's the standard vasectomy or conventional vasectomy. Also, there's then the non-scalpel vasectomy. A vasectomy is a surgical procedure for male sterilization. Here you can see the vas deferens, and this is basically what's cut and interrupted, and you can see the vasectomy site following where it's interrupted. Okay, I'll continue once again. Okay, so Bismillahirrahmanirrahim. Have the courage to follow your heart and intuition. They somehow know. Sorry. Bismillahirrahmanirrahim. Have the courage to follow your heart and intuition. They somehow know what you truly want to become. Steve Jobs. Family planning permanent methods. My name is Rida Shahram Sarwar, and under my supervisor, Professor Dr. Saira Afzal, I will be presenting today. Permanent methods include vasectomy and tubal ligation. Vasectomy is 99.9% effective, as is tubal ligation, as quoted by Healthline. Learning outline. Introduction to family planning, types of contraception, indications and contraindications of methods mentioned, male sterilization techniques, female sterilization techniques, advantages, disadvantages, and recent advances in the field. Learning outcome. At the end of the presentation, participants will have a broad overview of the different types of sterilization techniques employed for both males and females, their advantages, disadvantages, procedure, processes, practicality, and indications for couples when it comes to family planning. Family planning. Family planning is the voluntary planning regarding childbirth. That is, childbirth should be according to desire or choice, not by chance. By controlling birth through family planning, the size of the family can be limited and population growth can be controlled. This helps individuals save lives, support families, and benefit societies. Family planning refers to practices that help individuals and couples to attain certain objectives, which include to avoid unwanted births, to bring about wanted birth, to regulate the interval between pregnancies. Contraception. The methods or devices used to prevent pregnancy are known as contraception, and basic meaning of contraception is prevention against pregnancy. Types of this include temporary and permanent. Temporary methods include condoms, diaphragms, chemical methods, hormonal methods, and intrauterine devices. And permanent methods of sterilization include vasectomy in males and tubectomy in females. This is a diagram of vasectomy and tubectomy where you can see the fallopian tubes being tied and cut. Guidelines for sterilization include the husband's age should be between 25 to 50 years, wife age between 20 to 45 years, must have 2 living children. If the couple has 3 or more living children, the age limit may be relaxed, and you also need consent from your spouse. In males, sexually active and physiologically adjusted husband with desired number of children, and in females, after having desired number of children, medical diseases like diabetes, hypertension, renal disease, for preventing ovarian and peritoneal cancer, fetal malformations like hemophilia, Tay-Sachs disease, Marfan syndrome, multiparity, and 3 cesarean deliveries. Contraindications include women less than 25 years of age, parity less than 2 children, local infection, and prolapse. Male sterilization or vasectomy includes the standard method or the non-scalpel vasectomy. Here you can see the vasectomy site, which is the vas deferens, being cut and interrupted. The vasectomy consists of dividing the vas deferens and disrupting the passage of sperms. There are 2 methods of this, conservative and non-scalpel. Technique of the conservative method includes procedure is done under local anesthesia. The vasa is palpated between the top of the testes and base of penis by 3 fingers. It's then grasped with a ringed clamp. Skin is punctured by with dissecting forceps, and vasa is dissected using forceps. It's then ligated at 2 sides. Facial interposition and diathermy is then done. A same procedure is repeated on the other side. Skin suturing is not necessary. Wound dressing is done and scrotal bandage is worn. Histological examination of vas for confirmation and postoperative antibiotic and analgesic is given. Heavy work should be avoided. 20 ejaculations are required to empty the semen stored in the vas, so the man is sterile for 3 months. 2 semen analysis at 12 and 16 weeks show the absence of spermatozoa that are required to declare a man as sterile. Non-scalpel is the latest and most popular technique. No incision is required. Puncturing the stretched skin of scrotal sac with a sharp instrument, locating the vas deferens and cutting and ligating the tube. Advantages of this procedure include that it is permanent, safe, and inexpensive. Sperm production or hormonal output not effective, doesn't interfere with sexual pleasure. Cheaper, simpler than a tubectomy. Hospitalization not required. Recanalization is not possible and can be conducted anywhere. Disadvantages include pain, hematoma in scrotum, local infection, impotency, headache, or uneasiness due to physiological fear. Spontaneous recanalization in some cases, expensive and short-term, permanent regret in 5 to 10% of patients. No protection against STDs, including HIV, and not effective until sperm remaining in the reproductive system are ejaculated. Female sterilization. Here, the fallopian tubes are tied and cut. Also known as tubal ligation or tubectomy, is a surgical procedure in which the fallopian tubes are cut and sealed in order to prevent fertilization. It is the removal of part of the fallopian tube, which essentially basically blocks ovulation. There's 3 methods of this: puerperal, interval, and with lower segment C-section. This is an operation which is done within 24 to 48 hours following delivery. The interval one is beyond 3 months after delivery or abortion, and proliferative phase of the menstrual cycle. And in lower segment C-section, it's accompanied with or in case of abortion. Methods of tubal ligation include occlusion methods, which are partial self-injectomy, clips, fallope rings, electrocoagulation, or cauterization. Tubal ligation is one of the most common surgical procedures performed on women. It also known as getting one's tubes tied. It is a surgical procedure for permanent female contraception. It involves blocking, cutting, or sealing the fallopian tubes, which are structures that carry the eggs from the ovaries to the uterus. By blocking or interrupting the fallopian tube, the procedure prevents the sperm from reaching the egg, thereby preventing fertilization. Despite the high rate of effectiveness, all women who have undergone tubal ligation but miss a period should be tested for pregnancy because ectopic and intrauterine pregnancies, although rare, they may occur. There are different methods of performing tubal ligation. Laparoscopic tubal ligation, this is the most common method, and it involves making small incisions near the navel and lower abdomen to which a tiny camera laparoscope and surgical instruments are inserted. The surgeon then blocks, cuts, or seals the fallopian tube using clips, rings, or cauterizing a small section of the tube. Then there's a mini laparotomy. This method involves making a slightly larger incision in the abdomen, usually near the navel. The fallopian tubes are accessed through the incision and treated in a similar manner to the laparoscopic tubal ligation. Then there's the hysteroscopic tubal ligation. This method involves accessing the fallopian tubes through the cervix without making any external incisions. A hysteroscope is used to guide the placement of small implants or coils inside the fallopian tubes, causing scar tissue to form, and that's going to in turn block the tubes. The use of spring clips is associated with the highest rate of pregnancy following sterilization. Advantages of tubal ligation: it's highly effective preventing pregnancy with a failure rate of less than 1%. It's permanent, provides long-lasting contraception without the need for ongoing maintenance or remembering the use of contraceptives. It doesn't affect hormones. Unlike some hormonal contraceptive methods, tubal ligation does not involve altering hormone levels. Disadvantages of this includes it's irreversible. Reversal is not always successful, and the chances of conceiving again after reversal are not guaranteed. It's a surgical procedure which carries risks associated with anesthesia and surgery. There is no protection against STIs, which are sexually transmitted infections. Personal decision: the decision to undergo this should be carefully considered, as it's a very permanent choice. Then another method is transcervical tubal occlusion. This is a minimally invasive method of permanent female contraception that involves blocking the fallopian tubes without the need for an abdominal incision or general anesthesia. This procedure is known as the Ashore procedure or an Adiana. This is designed to create scar tissues within the fallopian tubes, which eventually block the tubes and prevent the sperm from reaching the eggs. Women who have had this procedure should abstain from unprotected intercourse for 3 months to avoid pregnancy until the scar tissue develops, and the effectiveness of the procedure is then verified with an HSG test. Techniques of tubectomy include abdominal and vaginal. Vaginal is simply laparoscopic hysteroscopy, and abdominal includes all three, which is laparotomy, mini laparotomy, and laparoscopic hysteroscopy. Methods by the entry site, methods of tubal ligation as classified by entry sites of the roots, which include laboratory method, Pometry method, Irving tubal ligation, Uchida method, laboratory tubal ligation, mini laparotomy, vaginal tubal ligation, which is called colpotomy. Vaginal tubal ligation: the fallopian tube is drawn out through a small opening made in the vaginal wall and ligated with suture material. This procedure is done under local anesthesia, and there would be no visible scar. Timing for this for tubal ligation includes postpartum or puerperal tubal ligation performed any time within the 3 days of childbirth. Cesarean ligature procedure is done during C-section. Internal tube ligation procedure is done after 3 months following delivery or abortion, and then concurrent with MTP sterilization is done along with termination of pregnancy. Advantages of female sterilization include very effective method of contraception, does not require continuous motivation or supervision, minimum complications, less expensive, no interference with sex, and disadvantages include pain and local infections, injury to internal organs, bleeding at the incision site, and irregularity of menstrual cycles. Permanent methods of family planning are well-established contraceptive procedures for couples desiring no more children. Permanent methods are cost-effective one-time methods and give effective protection against pregnancy. Recent advances. Permanent contraception for women. Abstract. Permanent contraception is a highly desired and commonly used contraceptive option for women around the world who desire never to become pregnant. Current methods of female permanent contraception require surgery. Postpartum tubal ligation and interval surgical tubal ligation are safe and effective, do not interfere with menstrual cycles, and require no ongoing cost or medical checkups. Hysteroscope tubal occlusion offers a less invasive surgical approach but requires an imaging study for verification of correct placement. However, not all women have access to a surgeon trained to provide permanent contraception, or they may face other prohibitive logistic or financial burdens. Second is a survey of attitude towards permanent contraceptive methods. Abstract. Four groups of white English family planning clinic attendees were studied. 61 males having undergone a vasectomy 12 months previously, and 58 men currently attending for vasectomy. 60 female partners of men currently undergoing vasectomy and 52 undergoing sterilization by tubal ligation. All patients completed a questionnaire which included questions on the reasons for selecting their chosen method and attitude towards permanent methods of hypothetical pill and injectable methods for men. Included questions on the reasons for selecting their chosen method and attitude towards permanent methods and hypothetical pills and injectable methods for men. Results show that contraception was generally regarded as a mutual responsibility. This attitude was more pronounced in the vasectomy groups than among the sterilization women. Generally favorable reactions were elicited with respect to vasectomy, although a substantial proportion, 40%, expressed a preference to alternative methods. MCQs. Family planning is the voluntary planning regarding childbirth. That is, childbirth should be according to desire or choice, not by chance. What is the most effective methods of terminal sterilization in females? A. Contraceptive pills. B. Intrauterine devices. C. Diaphragm. C. Tubectomy. Or E. Vasectomy. The answer is D. Tubectomy. Question 2. Tubal ligation is very effective in preventing pregnancy with a failure rate of less than 1%. Postpartum or puerperal tubal ligation performed anytime within how many days of childbirth? A. Immediately on the same day. B. First 3 days. C. A month. D. A week. E. 9 months following birth. The answer is 2B. Question 3. In colpotomy, the fallopian tube is drawn out through a small opening made in what structure and then ligated with suture material, leaving behind no scar? A. Labia majora. B. Hymen. C. Vaginal wall. D. Urethra. Or E. Cervix. The answer is C. Question 4. Vasectomy consists of dividing the vas deferens and disrupting the passage of sperms. After this procedure, how many ejaculations are required to empty the semen stored in the vas so that the man is sterile for 3 months? A. 20, B. 5, C. 1, D. 100, or E. 3.
A.
Yes, the answer is A. Question 5. Transcervical tubal occlusion is a minimally invasive method of permanent female contraception that involves blocking fallopian tubes without the need for an abdominal incision or general anesthesia. This procedure is also known as A. Laboratory method, B. Assure procedure in Indiana, C. Colpotomy, D. Irving's ligation, or E. Vomitory method. The answer is 5B. Question 6. Transcervical tubal occlusion is designed to create scar tissue within the fallopian tubes, which eventually blocks the tubes and prevents sperm from reaching the eggs. Women who have had this procedure should abstain from unprotected intercourse for how many months to avoid pregnancy until the scar tissue develops? And effectiveness of procedure is verified by HSG. A. 1 week. B. 10 days. C. 3 months. B. 10 months, or E. 1 year.
1 week.
No, the answer is C. 3 months. Question 7. Hysteroscope tubal ligation involves accessing the fallopian tubes through the cervix. A hysteroscope is used to guide the placement of small implants or coils inside the fallopian tubes, causing scar tissue to form and block the tubes. The use of what item is associated with the highest risk of pregnancy following sterilization? A. Coils. B. Bands. C. Implants. D. Spring clips. Or E. Rubber rings.
C.
No, it's spring clips. D. Question 8. Tubal ligation, also known as tubal sterilization of getting one's tubes tied, is a surgical procedure for permanent female contraception. It involves blocking, cutting, or sealing of the fallopian tubes. How does this procedure cause sterility in females? A. Reducing libido or drive in females. B. Blocking the fallopian tube that prevents the sperm from reaching the eggs, thereby preventing fertilization. C. Creating hormonal imbalance and delaying ovulation. B. Intercepting with embryo implantation. Or E. Destroying the lining of the cervix.
B.
Yes, the answer is B. Question 9. There are two methods of vasectomy: conservative vasectomy and non-scalpel vasectomy. Vasectomy consists of dividing what structure and disrupting the passage of sperm, thereby causing sterility. A. Vas deferens. B. Urethra. C. Epididymis. D. Bulbourethral gland. Or E. Scrotum.
C.
No, the vas deferens. A. Question 10. Conventional vasectomy is a simple operation performed under local anesthesia involving clamping and cutting of both vas deferens. In vasectomy, the incision is made through what body part? A. Abdomen. B. Penis. C. Scrotum. D. Breast. Or E. Bladder.
C.
Yes, the answer is C. This is the key. These are my references. Thank you.
Thank you very much, Dr. Rida.
Thank you.